Our big story this morning at 5, respiratory illnesses in kids on the rise in Arizona, and the increase in cases drawing concern among doctors who are watching other states deal with a triple threat of viruses. This is 12 News Today in AZ. Welcome, everybody. I'm Scott McDonald.
I'm Emily Pritchard. Appreciate you starting your Wednesday with us. Team 12's Jen Wald is joining us live this morning. Jen, what are doctors saying?
Yeah, good morning to you. So nationwide, nearly 75% of pediatric hospital beds are full, and this is coming well before the anticipated winter peak of respiratory illnesses. Now, good news to report here from Phoenix. That is not the case at Phoenix Children's Hospital. There are plenty of beds available for sick children in our state. However, they are seeing an earlier than normal rise in RSV cases here already, and so doctors tell me they are watching that very closely. RSV is a respiratory illness that can cause symptoms in children similar to the flu. With this virus, doctors worry about patients younger than 6 months old or those born prematurely or with something like a heart or lung condition. The underlying conditions can make them more vulnerable to more serious infections, leading to hospitalization. The illness is not as big of a deal for adults, usually causing cold-like symptoms, but adults can spread RSV to children who are at higher risk for that serious infection. While RSV is spreading, doctors are also concerned about an increase in COVID-19 cases in our state and a potentially bad flu season, which could cause more co-infections in Valley children.
A combination of two different viruses at the same time. And we know clinically that those patients actually have a worse kind of course during their infection because of that, what we call co-infection, where they're having two viruses at the same time.
So how do you know if your child has COVID-19, the flu, or RSV? The respiratory viruses share many common symptoms: coughing, fever, difficulty breathing, congestion. Well, Phoenix Children's Dr. Wasim Balan says if the child is struggling to breathe, to call the doctor or head to the emergency room for treatment and testing. There's also a risk of dehydration. While there's no vaccine for RSV, doctors are also urging parents to vaccinate their children against COVID-19 and the flu to help keep those severe infections down this season. And as far as why RSV cases are on the rise right now, again early, well, Dr. Balan is pointing to the last couple of years. We all had those measures in place, social distancing to help protect us against the spread of COVID-19. Well, now you have these children who don't have these immunities with things like RSV, and so they're speculating that that could be leading to another early rise in RSV cases across Arizona. Again, they're going to continue tracking this throughout the season. Now, coming up live in the next hour, we're talking with Dr. Balan about Phoenix Children's Hospital and plans they have in place right now in case we start to see this triple threat of viruses rise in Arizona. For Number Live in Phoenix, Jen Walt, 12 News Today in AZ.
Yeah, Jen, thank you.